Okay.
Here we are.
And we're live on a special Sunday edition.
Do it live!
Do it live. Well, we will record in the full color spectrum.
That's right.
Sunday, right after Thanksgiving. I had a great Thanksgiving. How about you?
Oh, it was tremendous.
Fantastic. Ready for the week ahead as we dive into the last part of the year. And what did we want to talk about today, Kyle?
I think today we're going to cover neck pain. So many people suffer from neck pain all the time, but so few people know how to treat it or where it's actually coming from. They just know that they feel it, that they usually are restricted motion-wise, and they know what not to do to make it hurt worse usually.
Yep.
But
particularly in a lot of athletic populations.
Yeah, especially exercisers.
I see it a lot in my recreational athletes where you sit at a day job and you use your body in vastly different ways than when you're trying to throw a big weight over your head.
No doubt.
So that transition sometimes tricky.
Yeah, for sure. So if somebody walks into the clinic and let's say they say, man, I'm just having a ton of pain that's right up around here. What's going on? Let's get this thing fixed quick. What's on your radar? What are you thinking? Where could it come from?
Oh gosh, spine, things get tricky near the spine.
Yeah.
But my usual thought process is it can either be coming from some sort of aggravated muscle.
Yep.
It could be some component of the joint being suboptimal or having forces put on in directions it's not appreciating.
Yep.
Which also kind of crosses into the nervy side of things. So I say muscle, joint, nerve. What else you got?
I mean, I think those are the big ones. I would probably, sometimes people always hear they have a slip disc or, a disc out of place or whatever. I mean, none of that actually happens. They just don't like slip around or move around significantly. But sometimes if you have a ton of, numbness, tingling, and a bunch of weird stuff going on, we're certainly going to screen that up front.
Yep.
And just the disc being irritated sometimes can cause pain in there. That doesn't seem too bad because it's not like I can't feel my hand, but it definitely could be coming from there based on some clinical testing. So I totally agree. I'm usually thinking, is it coming from like a disc or something that could be really significant in there? Is it coming from those little small joints that are up and down the neck on each side and where that nerve comes out through there?
Yep.
That's like your classic kind of crick in the neck situation sometimes. And then do they have something muscular because they sit like that, or they did something crazy when they were lifting? I mean, it could be 1,000 different things. It's not always postural, but those are the big three things that I don't know, I guess I'm typically thinking of, and
they're all related.
Yeah, they're all related, and that's why getting an assessment and a thorough assessment for somebody that knows, what the heck they're doing is so important, because a lot of times it's not so easy to say it's just that. Somebody needs to spend that full hour with you and say, look, this is what I primarily think it is. You could have some of this going on as well, because every system, connects and works off of each other. What else in terms of those three that would you look at? Anything outside of that? Or anything else that's on the radar with that person?
I think the process, like we've alluded to before, is very similar. Screen out all of the crazy bad stuff.
Yep.
And then go by symptoms.
Yeah.
So, if they're not having any like central core type things, like changes in their bathroom habits, or other things that are kind of like wee woo wee woo. Then you go by what makes it better, what makes it worse.
Sure.
Because kind of going along, like we talked about before, radiologically, different tissue does not necessarily mean injury tissue. So all of the special tests and stuff we do traditionally were compared against tissue pathology, which now we know doesn't actually cause symptoms.
Right, which sounds weird, but basically what we're trying to say is, you probably don't need an x-ray unless something real crazy is going on, and then we might send you to somebody.
And there's some very well done rules for that, Ottawa C-spine rules.
Yeah, and smarter people than us have come up with that. So refer out if we need to.
Yep.
And then, secondarily, a lot of people have real funky x-rays out there that are totally normal, who've never had pain before, right? It happens all the time. So just because somebody tells you some of that you've got going on, a lot of times people come away with that thinking, oh, that's my issue. Where really what they need is to find a good PT, good chiro, good practitioner, healthcare provider, good MD, who's then going to go through that list that we just talked about. We have a whole bunch of different tests that we can do to rule each of those out and dial in a diagnosis, and then that helps us take that next step of treatment that's both, again, cost effective and quick, but is getting after what really is probably causing your symptoms, not some magical picture that we took once.
Yeah, and once you've figured out, once you've ruled out all the bad stuff, go by symptoms. What makes it better? What makes it worse? We can make some educated guesses.
That's it.
And then you, as the patient, who is the expert on your neck,
absolutely,
we know about necks. You know about your neck. We work together, and then we figure out what makes it better for you. We teach you how to do it, and then you just go take care of it.
Bingo, easy, done. So if you've got neck pain, find somebody that's smart like us. Yeah.
It comes and goes.
It comes and goes. But more often than not,
yeah.
I think we're right on the money. So find somebody that knows what they're talking about. If you've got some neck stuff going on, certainly reach out to us. Like always, comment, leave us some feedback, and we can always do some follow-up videos.
Absolutely.
You know, about what we would do, treat, and you know, what else is specifically in the plan for us with necks.
Yeah.
Sound good?
Sounds good.
Cool. See you next time.
Next time.